Good afternoon, everybody. It's Dr. Galvin with a Monday coronavirus update. Thought we'd go through numbers, which we haven't done in a little while. Worldwide crossed 10 million cases, over 500,000 deaths. Here in the U.S., 2.6 million cases, 128,000 deaths. In our state of North Carolina, 63,000 cases, 1,300 deaths. We've had 2.6 million cases in the U.S. How does that compare to the rest of the world? Well, it doesn't compare well. The next highest number of cases are in Brazil. They've got 1.3 million. And if you guys know anything about Brazil, they basically pretended the virus doesn't exist, have done nothing, and are facing a massive catastrophe there. They've had 57,000 deaths. Next after that is Russia, 640,000 cases, although a lot of people think that they are far underreporting those numbers. They only claim 9,000 deaths, but most people don't believe those numbers. And the third next highest is 550,000 cases in India. So we're anywhere between 2 and 5 times more cases in the US than anywhere else in the world. I think locally in North Carolina, where the numbers I am very familiar with, I'm looking at right now, I think we've got 843 people who are hospitalized, and I think that that's the number that I look at pretty consistently. And those numbers have stayed in this state pretty steady. Now, in states like Arizona and Texas, those hospitalization and utilization numbers are going up and up and up, and that's concerning. And I think you need to look at it, perhaps from my perspective as an emergency physician, is a little bit different than maybe looking at it from a layman's perception. When I see numbers of 843 admissions at the end of June, which is the highest point we've had since the beginning of the virus, I know a couple things. One is that I know that I was admitting people in March with very mild symptoms because I didn't know much about COVID, and nobody really did. And we were admitting people that were positive for COVID that had risk factors because we were afraid they were going to rapidly deteriorate and become, and be at risk. As we got better at diagnosing these cases and treating them, we learned that that wasn't the case. So now, someone that I would have admitted back in March when we knew very little, I sent home now. So the people that are getting admitted to the hospital are pretty sick. And probably a fairly significant number of those people are going to go on to require ICU level care because, as we know in the medical profession, those people that get admitted very often deteriorate a week to 10 days later and end up in the ICU potentially on a vent. And so that number is concerning. Right now I think we've got 27% capacity left in our inpatient side and 24% capacity left in our ICU side, meaning that like 76% of the ICU beds are being used in state, which is good. So we've got capacity, right? Well, those numbers are going up and up and up. And remember, this is the time of year where we expect utilization to be at its lowest because the flu season comes, late November, early December, peaks and ends in about April. And when that happens, volumes in the emergency department, volumes in the hospital go up 25-30%. So we anticipate that, but if our numbers are already 25% or 30% higher than they're supposed to be, you can see that additional load on the system, plus an anticipated additional surge of COVID as the winter months come, can really be disastrous. So we've got to be planning for that now, and we've got to get a hold of what's going on. My friend John Bream, who's been on this a few times, and I'm going to ask him to come back again, put a post on his site the other day about the 3 W's. And I don't know if John came up with this or if he saw it someplace else, but the 3 W's were, wear a mask, wash your hands, and walk 6 feet apart. And those are things that are going to minimize transmission. So if you happen to be asymptomatic and you've got the virus and you're able to transmit it, if you do those 3 things, your risk of giving it to somebody else is much, much lower. And if the people around you are doing it, your risk of catching it from them is much, much lower, and numbers are going to go down. What we want to avoid is locking things down again. What's happening in Arizona and Florida and Texas, they're going in the reverse, right? Those are the places that very aggressively, against anybody's recommendation, opened up, even though they had rising numbers of cases. And that was like a month ago. And now, lo and behold, they're facing disastrous results Arizona is at capacity, and some in Texas have cities where they're at capacity in terms of ICU and hospital utilization. Is this a surprise to anybody, really? I mean, come on, we could have anticipated this. So if we want to avoid that elsewhere, we need to do these things. Masks are not political. The virus is not political. The virus could care less what your politics are. It will infect you if it's given the opportunity. How do we prevent it from getting that opportunity? Wash your hands, wear a mask, and social distance. We don't want to reclose the economy. Well, I read an interesting report about credit card utilization in Houston where they're having a terrible outbreak. Guess what? Nobody's spending money there. You know why? They're locking themselves in place, even though there's not a lockdown in Houston, because the numbers have gone off the charts. People are self-isolating. The government's not mandating it, they're doing themselves. And it's having the same economic effect that shutting the economy does. So if we let this virus get out of control, it doesn't matter whether we lock down or not. People are going to be afraid. They're going to stay home. They're not going to go out. They're not going to spend money. And the economy is going to crater despite opening the economy back up. So we've got to do these things. I think that we're seeing that these states that were aggressively reopening are re-examining this thing, and they're pulling back. They're closing bars. And we talked about, how do you get this? Well, indoors, close proximity, yelling, singing, shouting. So, bars, restaurants that are really packed, concerts, unfortunately churches, and we've seen throughout the country, outbreaks. There was that outbreak in 85 patients in Lansing, Michigan. There was an outbreak in Wilmington, North Carolina related to a bar. There was an outbreak related to a packed church service in Washington State, and the list goes on and on. And what do we know? Close proximity, indoors, tends to be very, very risky. Why are all these things happening in the South? Well, one reason maybe, it's getting hotter down here, and so people tend to go into places that are air conditioned. I know locally we've got a lot of gyms that are opening up against sort of the governor's orders. I don't know if we'll start seeing cases from there. I know that the gyms that are reopening against the governor's orders are trying to do everything they can to make it safe. And there are some places that are just physically able to do it by having expansive amounts of air volume and being able to open up garage doors and run fans and having lots of airflow. But there are some gyms that are really, really small, and those are probably high-risk places. Going on to sort of treatment and where are we going with this? Well, we need to get these numbers under control because we really do anticipate that numbers will go back up in the wintertime. Why is that? Well, because for one thing, we're going to start dealing with flu season again, and every year we have flu season, and people start getting, when we say flu season, we're not only talking about influenza, but there's lots of respiratory viruses that come in the wintertime, and in part that's because we're inside, we're close together, and we tend to transmit these things. A couple people have sent me some information, some questions about, this is ridiculous. Look at, the flu numbers went down to zero when we did these lockdowns. What happened to the flu? Well, what happened to the flu is we did these lockdowns, and guess what? If you social distance and you do these things, not only don't you transmit COVID, you don't transmit the flu and a lot of other viral illnesses. So of course those numbers are going to go down. But they're going to come back in the wintertime, and we also anticipate a second wave of COVID-19 come the fall. Now, if you look at nearly every other country in the world, we're seeing this huge spike, and then they lock their economies down. They taught their residents to wear masks, to social distance, to do all these things. And every country looks like this, a big spike, and it's like a mountain. It goes up, and now they're all going down, and now they're starting to open up, and numbers are going down all across Europe and Asia and nearly everywhere, except for the US, which is doing this. And a few other places like Brazil and Russia, which I really hate to be compared to. So we have got to, as individuals, take it upon ourselves to take this seriously and do the right thing and look out for each other, and follow those 3 W's, and let's try to cut this off because we need to get these numbers down, because if we go into the flu season at 75% capacity at ICU and hospital beds, we are going to very quickly eclipse capacity before we know it, and we're going to be in a world of hurt in terms of hospital capacity. Fauci was on talking about herd immunity and the vaccine, and we got a lot of people who are like, I'm not going to take a vaccine because of all this crazy stuff. And if a quarter of the population refuses to get vaccinated if a vaccine is available, guess what? It doesn't work, because herd immunity depends on having enough people in the population immune to the virus that the virus doesn't have hosts. And that's why we're seeing outbreaks of measles and things like that, because people didn't vaccinate their kids. And once that vaccination rate drops below a certain percentage, there's enough available hosts that the virus can reestablish itself. China has got a vaccine candidate, and they're just giving it to their military. So, if you got a communist country, you can do things like that. We're not like that, but you've got to look at these safety studies. But if we find a vaccine that's safe, to not take it because of some conspiracy theory, it's going to be useless if nobody uses the vaccine. Interesting thing about Remdisivir, another treatment. Well, the cost is not cheap. They're going to charge $3,100 for a 5-day course to private insurance, and a little less, maybe $2,200 if it's a government insurance. So that's not a very cheap treatment. Now, dexamethasone, which is steroid, which we've used for years and years, is dirt cheap, and that shows very significant survival benefits. Remdesivir has shown some benefits, although not life or death benefits, I don't think. There's still trials going on, but I don't know what dexamethasone costs, but I'll bet you it costs less than $100 versus $3,100. So that's interesting. Good news, though, is that although the numbers are going up, fatality rates aren't spiking that much, because in large part, what are we seeing? A lot of these cases are in young people. Now, why are we seeing it in young people? Because as things opened up, everybody decided that the virus was over, and mostly people have gone out, but young people in particular have been congregating and giving it to themselves. And I think I've mentioned before, I've got a number of teenage and now 20-year-old children, and my daughter Maya's turned 21 today, so happy birthday, Maya. But anyway, they all have got friends now, probably 6 or 7 of their friends that have been sick with COVID in the last week or two, having gotten it from being at bars in Wilmington and being at other places and being exposed. So they actually all know people their age that have been exposed and have actually gotten sick with COVID. They haven't even been seriously ill. So this younger population is getting exposed, but the concern is, are they going to expose their parents and their grandparents and other things? There are some new antibody studies that are showing that there's probably a fairly significant number of people that are having very minimal to no symptoms with COVID, and so maybe 10 times more than 10 times more people have had the virus than have actually been tested. So we really need to get testing ramped up so we can really identify where these hotspots are and really get an idea of what's going on. And we have to do a better job of getting this virus under control, because if we don't, we are really going to look at economic ruin in this country, because this virus is going to shut down economies, not based on edict from governments, but basically because people are going to be scared to do anything. If you've got numbers like in Houston or in Arizona or other places, are you going to want your family to go out to a restaurant or go out shopping? I think you won't. I think we've got to get those numbers down. We've got to see steady declines in numbers. We need to test. We need to track contacts so we can isolate people who are infected so they won't infect other people. We can do this. It's absolutely doable because every other country in the world has done it. There's no reason that we can't. Now, we have this independent streak and everything else, but it's not serving us well. And the things we're asking people to do, put on a mask, wash your hands, stay a little bit apart from people when you're out and about. Those are not hard things to do. I was personally out, and about doing a couple things, and I went to Walmart, and I was at Sam's Club and Academy Sports and a few other places. And we on Friday had a mask mandate put out by the governor, and I was, somewhat pleased that in those places I saw probably about 80 to 90% of people wearing masks, which I thought was a good sign. What I found was interesting was that the majority of people that were not wearing masks were, people that, to my eye, and remember, I'm a wellness physician and an emergency physician, so I can't help but look at people and sort of say, kind of catalog their potential medical problems. And they were in large part folks who were obese, who looked to me like they probably had chronic medical problems, who are probably at high risk. And one gentleman in particular had a big, tented out abdomen, which tells me, lots of visceral fat, certainly insulin resistant, probably diabetic. He was wearing shorts. He had no hair on his legs below his knees, which tells me he's got peripheral vascular disease, which probably means he's got coronary disease. And it probably means he's got hypertension. So I'm cataloging these probable diseases, and as you know, those are all high risks, to developing severe forms of COVID. So it's interesting that people who are at the highest risk seem to be the people who are, disregarding the mask, suggestions. So we want to protect ourselves. We want to protect our families. We want to protect everybody around us. I'm going to end it here. We'll do another COVID video later in the week. I'm going to probably do another one with one or two other physicians so you can get some other perspectives. We are continuing our weight loss series. We just did one about the psychology of weight loss. I apologize. I did say we were going to do something about intermittent fasting. We will do that this week, and then we'll do hormones and other things next week in terms of the wellness thing. We've also got Jennifer Frankowski, who's has a doctorate in physical therapy, who is going to be with me on a video this week about a program we have for elite and high performing athletes that we do at the clinic. So that might be interesting if you have interest in sports and athletic medicine. As usual, wash your hands, take care of yourselves. If you like this, please subscribe to our YouTube channel, follow us on Facebook. If you've got questions, put them in the comments or message us. Have a great night, and we'll talk to you soon. Stay safe.